of Mental Health Awareness Month, I'll be interviewing Ms. Ingrid Parker of Mind Well Services. The topic is mental health and our youth. And the scripture for today is Jeremiah 29:11. For I know the plans I have for you, declares the Lord. Plans to prosper you and not to harm you. Plans to give you hope and a future. That is God's plan for our children, to give them hope and a future. If you have children, you don't want to miss this interview. I will be right back after my intro. You know the drill. Like, share, and subscribe. Welcome back. So before I bring on Ms. Parker, let me read a little of her bio. Ms. Parker is a PA licensed professional counselor and a licensed behavior specialist. During the last 15 years, she has continued to develop her clinical expertise and management experience in nonprofit and for-profit roles across Montgomery and Delaware County, such as licensed clinician, clinical program manager, clinical supervisor, and director. Ms. Parker believes in a strength-based approach that is holistic, eclectic, and guided by the individual needs of the client. Ms. Parker enjoys working with clients of all ages, although she has an affinity for helping children and providing treatment for dual diagnosed individuals. So please help me welcome Ms. Ingrid Parker. Hi, Ms. Parker. Thank you so much for this opportunity to interview you on this very important topic of mental health and our youth. So I have a lot of questions I believe my audience will like to get information on, because it appears to be such an epidemic right now, mental health in our community. So thank you so much for accepting this interview, or this opportunity to be interviewed.
I am so excited to be here with you all tonight. Thank you so much for the invitation. And yes, I absolutely agree that mental health is an important topic, especially in this day and time. And I am so excited to be able to answer some questions for you.
Great, great. So I have a lot of questions, and I have my tablet right here because I want to stay on point with the questions that I have. So I'm just going to start off with some questions about you.
Sure.
So Mind Well Services was developed in 2020 in response to, let me read these acronyms, OMHSAS. What is that?
Oh, yeah, absolutely. So in the mental health field, we use a lot of acronyms, and that helps us to speak, I guess, more efficiently or quickly.
Okay.
But OMHSAS stands for Office of Mental Health and Substance Abuse Services.
Okay.
And the Office of Mental Health and Substance Abuse Services is an office within the Department of Human Services, which consists of an office of the deputy secretary, office of the medical director, and 5 bureaus called the Bureau of Children's Behavioral Health Services, the Bureau of Community and Hospital Operations, the Bureau of Financial Management and Administration, and the Bureau of Policy Planning and Program Development. And then one last one is the Bureau of Quality Management and Data Review.
Oh, okay.
Yeah.
Okay. And so that's why you started Mind Well Services. Is that because a lot of services was discontinued during COVID, during 2020?
Well, the reason why I started Mind Well Services was because I saw that there was a need for more providers in our particular area to, meet the needs of the community.
Okay. Okay. Great. Great. Mm-hmm. So you have 15 years of experience in professional counseling. What made you get into the field of counseling?
So that's pretty funny. I actually didn't start out with wanting to be a counselor. I actually started out with a huge interest in the medical field. I had ambitions to become an OBGYN, which is an
Oh,
obstetrician gynecologist.
yeah.
And I went to vocational tech school here in our local community, and I did an allied health program there. And I just really felt connected to the patients when we would have conversation. And I developed what people would call excellent bedside manner. And
Oh, okay.
it just really took over. And then I did an undergraduate program, and I really fell in love after taking an abnormal psychology class.
Oh, okay.
So I was like, yes, this is for me. It's definitely for me.
So it's great when you find a career that fits you. I heard that if you do what you love, you never work a day in your life. So I heard somebody say that. I think it was a basketball player that says that. That
Yeah,
said that.
I
That is great.
agree.
And now all of us are lucky to be in a field like that. Like I work in finance, and I've been in finance for 23 years, and it's not what I love. It's just what I fell into, and because I've been in it for so long, it's like it's all I have on my resume. But
Yeah.
God may have other plans down the line. Maybe after retirement. Who knows? Who knows? So, can
And
you describe to someone who doesn't know what mental illness is?
absolutely. So, mental illnesses are health conditions that involve changes in emotion, thinking, or behavior, or a combination of those. Mental illnesses can be associated with distress and
Mhm.
or problems functioning in social, work, or family activities. Um, a lot of people are ashamed about mental illness.
Right.
And I just want to make sure that I put it out there in this interview that mental illness is nothing to be ashamed of.
Right.
Okay. Someone asked me
Mhm.
a question about, is there a difference between mental illness and mental disorders? And I want to make
Oh,
sure that
okay.
I clarify that a mental disorder refers to a disturbance of normal physical or mental health of the mind.
Okay.
And mental disorders is kind of an outdated term. Um, that we used to use earlier in psychology, but now today, mental illness is the term that is used more widely to describe a person's mental well-being.
Okay. Okay. Oh, thank you so much for explaining that the difference between the two. I didn't think about that. What is the common problem you see in our youth and children today? And before you answer that question, I was born in the 60s and raised in the 70s, and I was born during a time where children may have had mental health issues, but we were to be seen and not heard. Um,
Mhm.
I mean, if we had like a breakdown or a tantrum, we would get a spanking. So any distress that we had will be cured with a spanking. So I mean, once we got that spanking, we straightened right up and didn't have the tantrum. And I remember when my brother was in school, during this time, for some reason, these classes where they had like a class with 2 grades in it. So they had like the
Mhm.
fourth and the fifth grade together. So I was in the fifth grade, my brother was in the fourth, and he was in the class with me. And he would throw chairs across the classroom at the teacher, and they
Wow.
would call my mother. They would call my mother, and she would come in,
That-
take me to the bathroom, and she would spank them and bring them back. Well, my mom said the cure for ADHD is the belt. So it's a spanking. So she said she'll understand all these kids on medications, all these kids being diagnosed with all these mental health problems. She comes from a generation born in the 40s. She was born in 45. That what is all this? With these kids having these tantrums and then everybody getting them diagnosed and they on medication. So, but what do you say about that? Because back in the day, it wasn't all this mental health awareness for children. It was like children really just suffered in silence, basically.
Yeah, I can understand that. To some people, I think there was less research and statistical data
Right,
available at that point in time. So what did they do as parents? They did what they could do, what they knew to do that was
right,
passed down through generations. But I am happy to say that we have these great organizations that actually put in the work and collaborate with researchers to provide us with more information. I can tell you that the CDC, which is the Center for Disease Control, released a report on children's mental health, which used data from a number of researchers and sources to describe some mental health disorders concerning children from 2013 through 2019. We are, of course, waiting on more updated information because we're in 2023 now.
Right.
But I can tell you that during that particular time, they talked about poor mental health among children being a serious public health concern. And in my clinical opinion, I believe that that is still something that we're struggling with today.
I believe that.
So interesting, like ADHD or attention deficit hyperactivity disorder and anxiety were among children of all ages, and they experienced symptoms related to depression. That was big among adolescents, and there were other common concerns. What they were able to come up with at that point was more information on positive indicators of mental health, such as like emotional well-being and resilience, which we really need to delve into more to truly understand children. I want to tell you that, as far as COVID-19, which is another huge factor that we're still processing at this point, after literally shutting down all of our systems, we're still wondering what those effects are going to be on children. So, while to touch on what you were talking about as far as those previous forms of discipline for children, yes, in some households, physical discipline or, punishment might still be used. And I would advise parents to continue to, do what is in the best interest of the child and to explore other ways to manage difficult behaviors. There are so many things that you can do: positive reinforcement, praise, encouragement, putting incentives in place, giving rewards. There are so many different things now that licensed professionals would say to try to implement in your home, other than, giving a child a whooping or a spanking, which I know that happens in a lot of households. So yes, I'm really excited to know that we are still trucking down this, this road here, trying to get more information about what works for our children, what treatments are available. And I would say for parents, if you're struggling with behaviors, seek professional guidance, seek help, get that psych evaluation done, talk to a psychiatrist about medication, go to someone who provides parenting support or services.
Right. Now, what would be the signs for parents to know it's time to get a psychological evaluation or get some professional help? What signs will they be looking for?
Yeah, that's a really great question, because a lot of parents, like you said, they don't know when their child is experiencing a mental illness. So because it's just really difficult to identify, and as a result, a lot of kids don't get the treatment that they need. So it's really important. Some of the warning signs that a child may be experiencing are persistent sadness that lasts for 2 weeks or more, withdrawing from or avoiding social interactions, hurting themselves, which we call self-harm, having outbursts or being extremely irritable, difficulty sleeping, weight loss, weight gain, changes with their academic records, avoiding or missing school. There's a whole list of signs and symptoms that, parents should be aware of. I would say, most parents usually have a gut feeling when they know that something is wrong. And when that happens, definitely seek help. The good thing is that when you do have older children, you are able to ask questions.
And what questions do you ask that child?
So when you have an older child or a child who's able to really verbalize
Yeah.
themselves, you
Mm-hmm.
want to ask questions like, how are you? What's going on at school? You want to ask them really open-ended questions where they have to
Right.
provide an elaborate answer.
Yes.
You don't
Instead of
want to
no
ask
or
them.
yes. Right.
Yes, you don't want to ask them close-ended questions where they can simply answer yes or no. You
Right.
want to say to them, what's going on with your friends? I've noticed this change in you.
Mm-hmm.
Do you feel like you need some additional support? Is someone hurting you? Things
Right.
like that.
So if you find that your child do need, what's the first step? Where do you go? Like, all right. So before we get to that,
Hmm.
um, a lot of parents, if they have an emergency, like a mental health emergency, their child is threatening to kill themselves, or they having like a mental, they're being disruptive, combative. Is there an emergency hotline that they can call? Who should they call?
Yes, absolutely. Absolutely. So the first thing that you want to do as a parent, guardian, teacher, some adult that is involved with a child who is having a mental health crisis
Mm-hmm.
is you want to validate the experience. So you want to say to them, I know what you're experiencing is really, really scary. It's really difficult. You're having a major challenge at this point. Let me
Okay.
help you. Is it okay for me to help you? Then you want to reinforce use of coping skills. And for every person, it looks different. So for some
Right.
people, it might be taking deep breaths. For another person, it could be counting to 10. It could be journaling. It could
Mm-hmm.
be reaching out to a trusted adult to explore their feelings and their thoughts. But you definitely want to reinforce the use of coping skills. You want to ask them clear questions about suicidal ideation,
Mm-hmm.
homicidal ideation, and self harm. So you want to directly ask them, are you thinking about killing
Right.
yourself?
Or
Are
hurting
you
someone
think
else.
are you thinking about
Right.
killing someone else? Are you thinking about hurting yourself or hurting someone else? Are you hurting yourself?
Right.
Questions like that.
And so if the answer is yes, who do you call? Because you can't handle the situation at this point.
So then that takes you to the next step. You want
Yeah.
to call natural supports, which
Okay.
could be, someone that the child trusts. You
Should you
can't
call the
just,
police? Should you dial 911?
nope, we have a few steps before we go there. So you
Okay.
want to call natural supports. You want to
Mm-hmm.
call grandma. You want to call uncle. You want to call auntie. You want to call our older brother or sister. Some
Okay.
other natural supports that the child is already familiar with.
Okay.
Then before you dial 911, which is only or should only be used in the case of a medical emergency, there
Okay.
is a number that you should call, which is 988. And
Okay.
988 is actually a number that has been designated as the new 3-digit dialing code that routes callers to the National
Okay.
Suicide Prevention Lifeline. And it's now active across the United
Oh,
States.
that's
So
awesome.
it's amazing. You can dial it from anywhere.
Wow.
And you can actually call it, text it, or you
Oh,
can chat,
wow.
and you'll be connected to trained counselors that are part of the existing Lifeline network. Now, for people
Wow.
who might not remember to call 988,
Mm-hmm.
you can still call the previous Lifeline number, which is 1-800 273 8255. And that's
Right.
going to always remain available because people may be used to contacting
Right.
that number in the
Right.
event that they're having emotional distress or a suicidal crisis.
I think the 988 number is easier to remember, like
It is.
911. And it's
Exactly.
sad that they don't advertise the 988, and most people have no idea about 988, and they still continue to doubt 911. I don't believe the police are educated enough to handle mental health crisis. They handle crime. And so when they come, they thinking that's what they're coming for. So if
Absolutely.
someone say my son said he want to hurt somebody, the cops is coming to take them down, you know. I don't think they can handle it. So I'm so happy that they have this 988 number, and I hope that people would share this number with their friends and family, because I'm starting to see a lot of children doing some real crazy stuff. Um, I'm sure you see it too on the news. You know, they form this mob and they go beat up people and they
Mhm.
what is going on? What would you say that the problem is? Now, for me, coming from the generation I was born,
Mhm.
the lack of discipline at home. They don't have respect for their parents, therefore they don't have respect for the teachers, therefore they don't have respect for the police. So that would be
Mhm.
why I see that's the reason why I see all these kids wilding out and doing things that we would never have done.
Mhm.
It's
Mhm.
just it's
Yeah.
just becoming so prevalent. Is that a mental health issue or just a
So
discipline issue?
So you touched on a few things. The first thing that you mentioned was, police and their ability to handle mental health crises
Yes.
or responding to a call for service where some type of a mental health consumer is involved.
Right.
Well, you're absolutely right. Police officers are not trained. At no point
No.
do they receive training in their academy to respond to how to respond to mental health crises. So, luckily, a lot of departments around the country are developing programs and bringing mental health professionals like myself, who's employed with the Norristown Police Department,
Okay.
to assist them in mental health crises, to give them training and additional support,
Great.
suggestions, and help them to collaborate
That's
with
really
mental
good.
health organizations to respond to mental health crisis or to provide better support to mental health consumers. So that was the
Wow.
first part that you touched on. And then
Hmm.
the next part is, you know, I do believe that a lot of the behaviors that we're seeing with our youth currently are because there is a lack of parent engagement with their youth.
Okay.
I don't believe that parents have all the necessary skills to deal with this particular generation of
Right.
children who are growing up at this point in time.
Right.
Um, I notice when I go into schools that the topics that these kids are discussing, the things they're engaging in, is very different from even when I was in school.
Okay.
So I definitely believe that we're dealing with a whole different generation of children who are facing a different set of problems. So we have to be
Right.
more inventive in our approach. And we definitely have to make sure that parents have a newer set of skills, a
Yes.
variety in their toolbox, so to speak,
Exactly.
so that they can best handle these kids.
Yeah. I think
Um,
I think the parents are using some of the skills that they use. Oh, they was raised on. I know myself when I
Absolutely.
raised my kids, I did the same thing. My mom did was extremely strict. I mean, they didn't have cell phones until later,
Yeah.
16.
Yeah.
In fact, my
It's a
two
different
oldest was out
generation.
the house before they got a cell phone. But
Yeah.
these kids are getting cell phones at age 8 or even younger.
I know. It's
Oh my
times have
goodness.
definitely changed. But you know what? There are parents who feel as though they're equipping their children with safety aids
Right.
because now their children can send a quick text if there's
Yes.
danger on the way to school, on the way home, in school, and they
Right.
feel like that's the best solution to, ward off any kind of safety issues.
Right. And
But
there's
it's
also a way you can track your children too.
Absolutely, yeah. But as far as like mental health
Hmm.
or mental illness with these children, I do believe that the COVID-19 pandemic has really had a major effect on our children
Right.
socially, as far as anxiety, their ability to concentrate,
Yes.
responding to adult directives. we
Yes.
we are dealing with some stuff that we've never seen before, and I definitely do feel as though the number of children who have mental illness it's skyrocketed,
Yes.
especially since the pandemic began in 2020.
Right. And when you said socially, I remember
Mhm.
interviewing a young person for like a temp position in my department, and she wouldn't give me eye contact the whole time. She kept looking down, and it was only like a temp job, and she was a college student, first year in college. So I said, "Is everything okay?" And she said, "You're making me nervous because you're staring at me." And I'm
Oh,
like,
wow.
um,
Yeah.
I'm
Mhm.
I'm interviewing you. And so I said, "Will you prefer me send you a text message?"
Probably,
Because
unfortunately.
they don't know how to socialize or they have that one-on-one facial contact because they text all their communication, and I'm a stranger, and
Um,
so I said, I just shook my head, I felt so bad for her, because it's just not her. It's a whole generation of kids who don't know how to communicate, and so if
mhm.
they don't know how to communicate, how can they articulate what they're going through and how they feel? Are they just going online and telling their friends? Are they keeping it to themselves? What are you finding with that communication part for our youth?
So, you know, at a certain age, I think, and you probably would agree with this, that children or adolescents, teenagers, they just feel more connected to their peers,
Yes,
and they do begin to share their thoughts and their feelings with them more so.
right,
It's just a natural, normal thing because that is what happens at that particular stage of growth and development for that age bracket. Um, and one of the biggest things is, like you said, that cell phone use and
yes,
social media.
yes,
And don't get me wrong, I think definitely that cell phone use and being on social media can be a really positive thing
right,
because it
right.
allows people to
It's a
stay
good tool.
connected. It is. It
Yes,
allows people to stay connected, but it's not the same kind of connectedness that we might have had previously,
right.
or like you were trying to have with that young lady that you were interviewing. Um, I definitely think that that excessive screen time, which seems to happen in every household,
Yes,
is really having a negative impact
yes,
on mental health and physical health of our
exactly.
children and our
Hmm.
adolescents. So at this point, I would say for parents, guardians, for teachers, for adults who are experiencing that excessive screen time or
Yes,
cell phone use with children that are in their system, that they really need to set boundaries and they need to put limits on screen time, whether
mm,
that's installing a timer where their cell phone shuts off during dinner time so you can have that one-on-one interaction time and there's eye
right,
contact and there's open-ended questions about how their day was and what's going on in their world.
yeah,
That's what parents definitely need to do. Our
right,
schools, they've gotta put rules and boundaries in place where they can't be on their phone during class time.
right,
So I think that putting rules or limits or boundaries in place is extremely important. Making it a priority to have that one-on-one contact,
right.
um, really strongly encouraging eye contact and
Yes.
use of open-ended questions. Those are like three major ways to improve that kind of behavior with our children and our
Mm.
adolescents.
So it's not just the phone or tablet, it can be the video games too. So
Yes.
kids become addicted to these things. I mean, the endorphins in their brains is like they're on a drug. So I saw a news story a while ago that really saddened me because
Mhm.
the boy was 13 years old, his father and mother decided to take the video games away because he was so addicted. He would get up in the middle of the night, he would be on the game, he wasn't doing his homework. So they did what every parent would do, remove the game and tell him he'll get it back when he get his grades up. Well,
Mhm.
he killed himself and he left a suicide note. And he said in the note that when you quit smoking, you had a patch, a nicotine patch.
Mhm.
What did I have to help me? So
Mhm.
he was just expressing how addictive this was, and he could not live without it.
Mhm.
And so, now parents are dealing with that with their kids when it comes to the phones, the tablets. I know someone, they said a 3-year-old come in the house, she want the TV on her station, she want the phone and the tablet. So it's like this, they taking over her with these electronics. What do
Yeah.
you do? How do you know if your child's addicted? And then what do you do? Do they get some kind of therapy for addiction? I mean, like, what do you do? That's another topic of mental
Yeah,
health addiction.
that's a big topic.
Yeah.
Screens, electronics. We could have a whole conversation about
Oh
that.
my goodness.
But as far as what I would suggest that parents do in that situation, I definitely feel like setting boundaries and limits is essential. You don't have to take it away completely, but you do have to put limits in place.
Yes.
Everything within moderation.
Right.
So, that it is excessive and it is not good for your child or your
Right.
adolescent when their world becomes strained, or you
Yes.
notice signs and symptoms related to some of the things I had mentioned before. You notice that they're irritable, that they're not sleeping, that their grades are declining, that
Yes.
they're choosing to engage in electronics or video games versus actually going outside or spending one-on-one
Right.
time with family and friends. That's how you know when it's
Yeah.
a problem.
Right.
And you
And
got to put the limits and the boundaries in place. And you have to say, hey, listen, instead of being on the game for 5 hours out of the day,
yes.
I will allow you to be on it for an hour in the evening after you're done your homework, after we've had
Yes.
dinner, that type of thing.
Right.
And it looks different for every household. It
It
should
does.
be individualized.
Right. And
But
it does look different for every household. And the kids in
mhm,
the city, they don't even have an option to go outside. When we told my mother we were bored, she was like, go outside and be back when the street lights come on. And we would play and we'd be very active. We didn't have those things, video games and phones and tablets. But the kids today, it's not safe for them in certain areas to go outside in the inner cities. So
mhm,
sometimes I feel like the tablet and the phones and the video games are like a babysitter to keep
yes.
your child occupied. And the more they sit, the more they eat, and the more their health is declining. So not only is their mental health is declining because they're addicted to something, or they may, be bullied online through like Facebook or something like that, but
Mhm,
their physical health as well. They
absolutely.
so the energy level is low, and the only joy that they get is when they looking at TikTok or it's just I just shake my head. I say I can't be raising kids today. I have grandkids and I worry about them.
Yeah,
But
I
it's
totally
difficult.
understand.
It's a difficult dilemma for the child and for the parent. There was
Mhm.
a time when, one parent was home, like the mom, usually. People are so busy today. So, what about sports and other activities to get your kids involved in that? Does that
Absolutely.
help increase, their mental, health as far as being active in a sport or something like that?
Oh yeah, definitely. As a school board director for the Norristown Area School District, I'm a huge advocate for extracurricular activities. I believe that all children should be engaged in some kind of extracurricular activity, whether that is sports or a music program
Right.
or chess club or drama, you name it. I believe that there should be some alternative that helps them to, first of all, increase their executive functioning and by
Right.
learning how to balance time and organization and assignments.
Yes.
It's extremely helpful for them to be able to interact with their peers and listen to adult directives. It's very helpful with concentration. There are so many benefits to engaging in sports and all of
Right.
the things that I just mentioned. So I'm a huge advocate for how that is able to benefit our children physically,
Yeah.
mentally, spiritually, emotionally. There's so many benefits.
Yeah. It's so good for them to learn how to play a sport and get involved with their peers on a positive, doing something positive instead of chatting online.
Yes,
Instead of chatting
absolutely.
online all day. So
Mm-hmm.
if you recognize that your child is having a mental health issue,
Mm-hmm.
and what's the first step? What's the very first step you should do? Um, Now, after that first step, and usually the wait is long,
Mm-hmm.
I know for a fact because I know people who have children who are dealing with some mental health issues, and this the waiting just to get assessed and to get counseling. What do you do while you're waiting? What's the first step, and then what do you do while you're waiting?
So, you definitely, like I said earlier, you want to validate the experience that the
Mm-hmm.
child is having. You don't want to belittle their experience. You want to let them know that you are there for them, that you
Yeah.
hear them. You want to make sure that you're asking those difficult questions about suicidal ideation, homicidal ideation, and self harm. You want to make sure that that they're using coping skills. You want to, if they don't have coping skills, you want to teach them coping skills,
Yeah.
because it's individualized. What works for me might not work for you. If I say I need to go take a walk around the block because that helps me to calm my
Right.
body down,
Mm-hmm.
that works for me. For you, it might be, oh, I'm going to, journal and write out my thoughts and my feelings, and that's helpful for you. So the coping skills that people use should be very individualized, and they should be effective. The next thing is bringing in those natural supports. You
Okay.
got to have your village to be able to come in and help you.
Okay.
Grandma, grandpa, whoever it is, has to be a trusted adult, though. We want
Right.
to make sure that we're not leaving
Yes.
a child to someone who is not going to be understanding and helpful at, like, during a crisis situation where you're
Right.
waiting on services to get in place. And you
Right.
want to make sure that you keep that 988 number involved, because
Yeah.
if there is a crisis where you need mental health support or crisis support to actually come out to your home or school or some community place to
Mm-hmm.
provide support, that you can reach out to them. 988 is the number.
So thank you so much for mentioning the village.
Mm-hmm.
I'm finding a lot of families are not including the aunt, the uncle, the grandmom. They
Mm-hmm.
prefer to just take care of their issues at home with their children, and they don't want their children to have any type. They don't want you to have that kind of influence in their child's life.
Mm-hmm.
So the village was very, very important when I was growing up, and it extended beyond the immediate family and grandmom and aunts and uncles. It was the neighbors,
Yeah.
and the neighbor was allowed to discipline us. So now you really cannot say anything to anybody's child. The
Mm-hmm.
child would curse you out, and then the parent would curse you out. If you can see a child doing something that's disruptive or bad or a bad behavior, smoking maybe, you can't say anything.
Mm-hmm.
And so what do you say about that? The adults. I, I don't know what kind of answer you can give about that.
So listen, that's a whole nother conversation we can have
Yes.
as well. But my thoughts about that are the generation of parents that are raising children at this point in time have experienced so many traumas over their
Right.
lifetime.
Okay.
And a lot of those traumas are unresolved. So they
Okay.
don't feel comfortable with cousin so being around their child, or
Right.
uncle, or grandmom, or pop or the neighbor down the street who they never
Okay.
talk to and don't know, because
Okay.
that's not the way communities are nowadays.
Exactly.
So a
Okay.
lot of that is unresolved trauma. It's not having a relationship with those family members or your neighbors. And yes, it is extremely devastating to our families and
Yeah.
our children's systems. I
Yeah.
do agree. We need our villages. I know I
Yes.
need mine. My children,
Right.
my husband and I, we have 8 children, and we
Wow.
could not,
What's the
I'm
age?
telling you.
What's the age range?
So our age ranges are 12 years old through 2 months old at this point.
They are
And
very small children, so I know you
yes,
need your village.
yes, we need our village. We need our
Wow.
village. And while we need our village, we are very tactful about who we allow to enter into
Yes.
our children's systems. And
Right.
we want to make sure that they're healthy adults that we can trust with our
Right.
children, especially when they're having vulnerable or difficult times.
Yes.
And, like I said, I believe that all parents should have that village. And it's
Hmm.
really up to us as a community to make sure that we're providing that support for them, that we let parents know that we are
Yes.
a safe adult, that they can count on us, that we're not going to let them down, that we're not going to hurt their children. I think the
Right.
more that as a community we put that support out there and make that message clear, it will really help families to build their village.
Right. Thank you so much for mentioning that. I really didn't think about that part of it. We living in a world where so much stuff is being exposed to our children, or we hear about kids being molested by the coach or the
Mm-hmm.
Boy Scout leader, and so a lot of it is trust issues. That information wasn't well known when I was growing up. But
Mm-hmm.
now it's out there, and so people are being very selective or not selective at all. They're just keeping their kids to themselves out of their own fear. So I didn't think about that. I just thought that because even the support with the teacher, like the teacher called the parent, and the parents, it's different. I mean, my mom immediately believed the teacher.
Mm-hmm.
The teacher called, I'm in trouble. It wasn't the mom going up saying, not my child. And, it's just a whole different generation.
It is. It is.
I don't want to get on the parents.
It is.
The teachers are scared to call the parent.
You're right, but at
in,
the same time,
in
it's
some
it's still
communities.
it's still their job to make sure that
Yes,
they're reaching out to those parents, that they help
they
those
have
parents to
to.
understand that they are in support of the child.
Right,
They want what's best for them academically and overall wellness.
right,
Like I said, that's where the community and all of these leaders have to really make sure that parents understand that you can trust me. I'm somebody who
right.
is really trying to help your child.
I have
And
your child and best interest at heart.
absolutely.
I'm not just picking on your child. I'm trying to
Yeah.
help you. So it will be helpful if the parents will, just engage with the teacher and hear
Hmm.
them out. Hear them out. The child is saying they're lying, and the parents is believing the child.
Yeah.
So that
It
that
happens
that
all
is
the
really a
time.
good point. That's really a good point. Let's talk a little bit about Mind Well Services.
Sure.
Y'all have a wide range of help that y'all give to your children, your community, the family, and the children. Is there a
Hmm.
minimum age for the child to receive services at your company?
Okay, so the youngest that we provide actual individual services for is 3 years old, and that
Okay.
will be through our IBHS, another acronym. It's Intensive Behavioral Health Services,
Okay.
IBHS. And
Okay.
the minimum age for that program is 3 years old.
Okay.
We do provide, parenting classes for parents who, are in the process of having a child or for
Okay.
new parents. So, we are able to
Oh, that's
provide
good.
support as well for them.
That's really good. So, at any age of your child, then suppose you have a 14-year-old, can you get parenting classes at that point, or should you have started?
Oh, yes.
Okay.
Listen, the earlier the better. The earlier the
Right.
better.
Right.
But
Right.
yes, if you're having difficulties with your
Yeah.
teenage child, reach out for support. I'm always available to provide support for parents who really need just that additional,
Yeah.
eye on things and clinical perspective. So,
Right.
yes, at any age, reach out for the support.
So you offer behavioral health help for your clients and
Mhm.
peer support services. Explain the peer support. Speak a little bit on that. I think that's a good thing. Peer, you think about somebody your age. So is it like a support group?
Yeah, so peer support services is a program through the Office of Mental Health and Substance Abuse Services.
Okay.
And we have peer support workers who have been successful in their recovery process, whether that is through, it's dealing with drugs and alcohol. And at that point, once they've been successful in their recovery process, they're able to help others who are experiencing similar situations through shared understanding, respect, mutual empowerment. They help people to become sober and stay engaged in their recovery process, which is a really great way to reduce the likelihood of relapsing.
Okay. What's the success rate of children who receive treatment or counseling? They go through the program. Is it a timeline that they have to go through it in 3 months and then you're done? Or does your organization follow them for a little while?
So as far as success rates, that's not something that we have actually tracked. But there are organizations who do track success rates for individuals or for children who are in treatment. The best organization I know who I could quote would be the CDC, the Center for Disease Control. And, in September of 2020, they put out information that indicated that children who are ages 12 through 17 who were more likely to have received any type of mental health treatment, including taking prescription medication. For a period of 12 months, the success rate was 16.8% compared to children ages 5 through 11, where their success percentage was 10.8. There's information that says that boys were more likely than girls to have taken medication and received mental health treatment over a period of 12 months. Non-Hispanic white children are more likely to receive mental health services versus people of color over a period of 12 months. And then, unfortunately, as the level of urbanization decreases, the percentage of children who receive any mental health services or take medication increases. So out in those suburban areas versus, urban areas, things look very different amongst treatment for children and adolescents.
Wow. So do you find that in certain areas, the availability of help
is,
I know my daughter who was working in the school district. She works for Montgomery County Health Department now. But she did work in the Philadelphia school district, and then she worked in the school district in the suburbs, and she found like a whole complete different outcome. She worked with special needs kids, and she found that in the inner city, these kids, they would just grab them, and they would just, the treatment that they got was totally different from the suburbs. They had all these people supporting the kids in the suburbs, it was just a kinder approach. And I think it was because the lack of, staff members to help them deal with certain situations. And so, it was just brutal to her what she saw compared to what she saw in the suburbs. All the support these kids got, phone call to the parents right away, somebody separating the child, calming the child down outside of the other way that they did it, in the city. And I think it's because the lack of staff, faculty help to deal with the kids. When I lived in the city about 5 years ago, I had a house built in Telford, PA, in the suburbs, and I just saw the difference. So during this mayor race, I said, "Who's the mayor in Telford?" I can't vote for the mayor in Philly. And then I found out each county has a mayor and each county has a school district. Compared to Philadelphia, there's one mayor and one school district. And so that's the difference I see that's going on in the suburbs compared to the suburbs in the city. There's more help, more offices, more mayors, more school districts that's running their own school district. Now you got this one school district in Philadelphia, but don't let me get on that subject because that's a subject, And so I feel like our kids they're feeling our children, in the city. I still think about those kids who can't get the help. And that was one thing I love about your organization. You have an out-of-pocket fund.
Yes.
For kids who need mental health assessment or counseling, and their parents don't have the proper health insurance, or their health insurance won't provide. Can you explain how we can donate to that out of pocket fund? I think that's a wonderful thing, because parents if they can't afford it or their insurance don't cover it, their children don't get the help they need.
Absolutely. So, like you said, a lot of times, that is the situation with families. And, as a mental health provider, I want to make sure that I'm able to assist as many people as I possibly can. So, when I do encounter a family who is not in network with me, or who might have difficulties paying for services out of pocket at the regular rate, I do allow them to receive reduced rates based on a sliding scale. So when I encounter people who want to make donations or contributions to support those individuals, it's amazing, because that just allows our organization and myself to be able to provide way more support for individuals and still receive a reimbursement for the services.
Right.
So
That's awesome.
Anyone who is interested in doing that is able to log onto our website, which is
it's scrolling at the bottom of the screen.
Yep, mindwellservices.com. They're able to click on online payments. There is a tab that's a drop-down menu, and they can click on services contribution and donate any amount that they feel comfortable with that would be designated to provide support to individuals who we are not in network with, or who aren't able to provide co-pays for their insurance, or pay those out-of-pocket expenses.
That is awesome. That's awesome to give people opportunity to contribute to help our youth.
Thank you.
Is there a national number, or is that the number you gave me? Not the 888 number, but a national number that people, because you're in the Montgomery, Delaware County area. Is there a national number that someone can call who don't live in this area to get connected with an agency in their area?
Yes, so that 988 is a national number.
So that's not just for emergencies. That's just
it's all over. It's a national number. But like I said, that previous lifeline number, 1-800-273-8255, still works for all of those people who memorize that phone number to call. You can still call that number and receive help when someone is in emotional distress or having a suicidal crisis.
Okay, great. So, Ms. Parker, I think you answered all my questions. And so I would like to encourage people, if you have other questions that wasn't asked, you can still on the YouTube, put a comment in, and I will get the question to her and comment back with the answer. So, Ms. Parker, thank you so much for this opportunity. Thank you for all that wealth of information that you shared. And I'll be talking to you soon. Thank you so much.
Thank you for having me on. I appreciate this opportunity.
You're welcome. So let's help our children, our youth, have their best life. Thank you for joining me. Talk to you soon. And don't forget to like, share, and subscribe to this YouTube channel so you can get more programs that will help you and your children and your family live your best life. Thank you.